Well, for more, I'm joined by Dr. Rebecca Inglis. She's the co-founder of Gaza Medic Voices. Thank you for talking to us this evening, Rebecca. Dr. Rebecca, the concerns of the World Health Organization, they are that there's now a very real threat from the spread of disease and also a collapse of the health system in Gaza. Just how real a threat is that now? From evidence of people that are working for you on the ground in Gaza?
Thank you. I think that it's safe to say that what we have at the moment are the textbook scenario for having big disease outbreaks. You've got huge numbers of people forced into a tiny area without any of the basic facilities that they need. There's no sanitation, there's inadequate food, as we've been hearing. And already we know that disease outbreaks are starting. So the latest figures that we have from the WHO say that the rates of diarrhea in children under 5 are 20 times what you would normally expect. So we know that there's diarrhea spreading, we know that there's chest infections, we know that there's skin infections, and these are all going to get worse. The problem is that because the health system has effectively collapsed, there is no effective delivery of healthcare to anyone in Gaza at the moment. What you end up with is people will suffer from these outbreaks and then they will not be able to get the treatment that they need to get them better. I've heard from doctor colleagues on the ground saying that children are being brought in with life-threatening chest infections and are going on to die from these chest infections because of all of these factors coming together: the poor nutrition, the poor sanitation, the cold, the wet. People are in absolutely terrible circumstances at the moment.
Dr. Inglis, without a ceasefire, how likely is it that further collapse of the order of society in Gaza will have an even more catastrophic impact on the region as a whole?
Well, I think that, well, I'm not well placed to speak to the regional destabilizing effect. I know that the UN have been issuing statements to that effect. I know that within Gaza itself, the continued lack of a ceasefire is going to lead to absolutely catastrophic effects on the population. I think that what we're going to see is the numbers of people dying as a result of this aggression, the ones who are dying not from the direct effects of the violence, which are huge numbers at the moment. What we're going to see, the outbreaks of disease, but also the sudden removal of healthcare for normal, routine, chronic conditions. So we heard yesterday from a colleague talking about the end of cancer services for children and adults in Gaza. We know already that the last hospitals who could provide that specialist cancer care have, been closed down a long time ago, but there's no chemotherapy, no hormone treatment, not even painkillers. So what you're going to see, in addition to these violent deaths, and the numbers are racking up, are that all of the chronic conditions are suddenly not getting treatment. People with diabetes are not getting their medication. None of this is happening at all. So not only are the people who are directly affected by the violence going to be suffering, there is a huge amount of hidden suffering at the moment that we're not seeing. In addition to that, all of these numbers of injured patients, without the treatment that they need, something as simple as a bad arm injury, a bad leg injury, can go on to get infected. We know that there aren't adequate facilities to give people the basic wound dressings that they need. You'll have seen pictures of maggots coming out of patients' wounds where they haven't been able to clean them properly. And those patients are at risk of getting blood poisoning and dying as a result of their wounds. And those numbers will just not be getting reported in the same way. We know that people are at immense risk at the moment of all of these injuries that are not getting treated adequately. In the hospitals at the moment, even those ones that are up and running, and as you say, at least 26 out of the 35 are completely out of service. The others are not able to provide the quality of care that they want to be providing to their patients. They're not able to save lives that normally they would be able to save. The same goes for amputations. So a close colleague spoke about how many amputations he's been doing every day since the start of the since the ceasefire, since the temporary pause stopped. He said that he's been conducting 20 to 25 amputations daily since the ceasefire ended. We're seeing huge numbers of injured. In the European hospital, one of the nurses working there mentioned that all she had done in her day's work, she messaged a few days ago and said that she'd been doing bilateral amputations, so cutting off both of the legs of the patients coming through, including a 2-year-old. So that 2-year-old is going to be suffering terrible conditions for the rest of their, for the rest of their life.
Horrific details. It's heartbreaking. It's devastating. Dr. Rebecca Inglis, thank you very much for talking to us this evening, co-founder of Gaza Medic Voices, with some harrowing details there.